William is 59 years old and suffers from gout and has had recurrent lower leg ulcers for 5 years. He has been treated by many people, all of which have been unsuccessful, and has resorted to dressing these himself because it was becoming too expensive to see someone to do this. Over the last month or two, these wounds on his legs have become very wet, and as a last effort to contain the fluid, he has been using plastic bags to manage the fluid. At the urging of his wife and daughter, he has made an appointment with his local GP to see what can be done. William arrives for his appointment with his GP and explains the history and the problem with his wounds. He has said that they're starting to impact on his quality of life. He is feeling depressed and he is too afraid to go out and socialize with his friends and family because of the smell from his legs. Dr. Smith has a look at the wounds on William's legs and realizes that this is not something that he can manage in his own GP practice. He recalls that there was a knowledgeable registered wound nurse who came to talk to him about Convacare clinics. Dr. Smith explains to William that he does not have the dressings or ability to treat these wounds in his practice. However, he will refer William to a specialist wound care clinic that will be able to treat his wounds in an appropriate fashion. The clinic has lots of experience with treating this exact type of wound and will be able to improve William's quality of life. He explains that the nurses are all specialists in wound management, and they will be able to give him the treatment and advice he requires. He gives William a pamphlet with the contact details of the clinic and sends him on his way. William immediately phones the Convacare clinic and is greeted by a friendly and helpful receptionist on the other side of the phone, who confirms that they are able to see him that afternoon. The receptionist SMSs William's confirmation of his appointment as well as the address. She ends it off with saying that Convacare is looking forward to seeing him. William arrives for his appointment at the Convacare clinic and is welcomed by the same friendly voice as he had heard earlier. His details are captured in an effortless manner and he is made comfortable in the reception area. William is taken aback at what a different experience this has been from any of his previous experiences with his wounds. The clinic is clean, calm, and echoes an aura of competence. Within 5 minutes, he is greeted by one of the wound care specialists and ushered down the elegant passage to a consulting room. William feels as comfortable and confident in the consultation room as he did in the reception room. He is blown away by the time that the wound care specialist, Pat, takes to listen and understand the history and current problems with the wounds on his legs. She reassures him that the wounds are treatable. She explains to him why his current and past treatments have not been successful. She lays out the exact treatment pathway for how, as a team, they're going to approach managing his leg ulcers. She reassures him that this is not an overnight fix. However, they will see improvement and they will achieve closure and get him ready to enjoy time with his granddaughter in the pool again. William leaves the appointment with his wounds dressed and for the first time confident that he will not live with these leg ulcers indefinitely. Over the next 2 months, William enjoys his weekly appointments at the Convacare clinics. He has developed a friendship with the kind, caring and competent staff. He doesn't feel like he's going into an intimidating medical facility, and the wound care nurses have been true to their initial commitment to manage his legs ulcers. For the first time in 5 years, his leg ulcers are almost closed. He is enjoying his life again. The leg ulcers no longer smell, are not wet, he is socializing with his friends and family again, and ready to enjoy that first swim with his granddaughter. 3 months after his first visit to the Convacare clinic, William, for the first time in 5 years, walks out without any wounds, dressings or bandages on his legs. He is ready for that first summer swim with his granddaughter. It is bittersweet, as he has developed a deep trust and bond with the wound care nurses and staff. They have become friends and impacted his life in the most meaningful way. He tells them he will miss his weekly visits. But with the advice and maintenance plans he's been given from the nurses to prevent his ulcers from developing again, he will be visiting to say hello and show them a picture of his first swim with his granddaughter.